Assalamualaikum students, hope you all are doing great with the grace of Almighty. I am also fine. I am Sonia, the teacher of Milestone Preparatory KG School, Uttara, Sector 7. So today I am going to take your science class and this is going to be on chapter 11, Life Safety and First Aid. And life safety is very important for saving someone's life. When someone meet an accident all on a sudden, initially we can give some first aid until we reach the hospital for the treatment. So in this chapter we are going to learn the first aid for certain accident. So let's move on to our class. Our classwork number is class 49 CW4 chapter 11. Today we are going to discuss the chapter 85 and 86. In these pages we are going to learn the first aid for a person who has met an electric shock, and in page 86 we are going to learn the first aid for a person who is bitten by a snake. After that, in book activity page 87 we are going to complete the book exercise. So topic till now we have covered are what is called an accident, what are the type of accident, how to prevent some accidents, and what are the first aid for burn and first aid for a drowning person. So in today's class we are going to learn what are the first aid for a person who has met an electric shock and first aid for a person who is bitten by a snake. So let's move on to our today's class. So let's start learning with electric shock. So electricity can pass through the human body. Our skin is one of the good conductors of electricity. So whenever a person is in contact with any electricity source, it can be a switch, if any part of the body is receiving an electric shock or the electricity is passing through the body, that person can have some injury or some burn, or it can bring some changes to the heart rate. This kind of accidents are called electric shock. So depending on the severity of the electric shock, this person can have mild injury to severe injury and death also. So let's learn what are the things we can do whenever we find someone having electric shock. How can we rescue the person and how can we give the first aid to the person. So at first, whenever you find any victim that have got electric shock, you have to rush to the power main switchboard and you have to unplug the power connection. After that, what you can do, you have to take a dry stick. If the person is in contact with any kind of electric wire, you have to remove that wire with the dry stick. But before that, you have to stand on a rubber mat or a gunny bag or a folded newspaper. It's going to save you from any kind of electric shock. After that, the most important thing, you are not going to touch that person with your hand because there is high chance of electric shock and you can also be the sufferer. So after rescuing the person from the electric shock, you are going to call the emergency service. The emergency service is going to help you to take that person to the hospital. But before they reach the spot, you have to arrange the first aid for the person. You have to check his consciousness, he is breathing or not, what is the pulse rate of that person, and what is the severity of the injury. If that person is having some burn, you have to give the first aid for burn at first. So what is the first aid for burn? You are going to use the cold running water to cool the burn for at least 10 minutes, and you are not going to apply any ice to that burn place, and do not break any kind of blister if it has formed in that place. Now you can apply some water mixed coconut oil on the burn spot. If it is slightly burned, then you can apply this one. Now check that person is breathing or not. If that person is not breathing, you have to create it artificially. Now how can you do that? You have to open the airway by gently tilting the back head and lifting the chin. Tilting the back head and lifting the chin. Now pinch the nose. Thus you are going to block the nose, and you have to place your mouth over their mouth and you have to blow until their chest rises. This is very important. If the chest is not rising, then you have to change the position of the head. So the person should be given the time to breathe out. After that, you have to give him the chest compression. How to give the chest compression? Give 30 chest compression by pressing down about 1/3 depth of the chest, and you have to continue to rescue breathe and chest compression until they start breathing. and after whenever the emergency service reaches the spot, you have to take him to the hospital for proper treatment. So thus you can save a person, you can rescue a person and give him a treatment who is suffering from electric shock. So I'm going to show you a small video in this topic which will help you to better understand. So let's see the video.
First aid, electric shocks. The human body is a good conductor of electricity. Direct contact with electrical current can even kill us. When an electric current passes through our body, it destroys the muscles, nerves, and tissues. It can cause burns or even affect the functioning of the heart. So, what should you do if you see someone getting an electric shock? First, try to stop the electric current, unplug the appliance, switch off the mains, pull out the fuse wherever possible. If the current can't be turned off, use a non-conducting object such as a broom, chair, rug, or rubber doormat to push the victim away from the source of the current. If possible, stand on something dry and non-conducting, such as a mat, wood, or folded newspapers. Don't use a wet or a metal object. Do not try to save a victim near active high voltage lines. Once the victim is free from the source of electricity, check the victim's airway, breathing, and pulse. If the pulse has stopped or seems dangerously slow or shallow, start first aid. Electric shocks can even give the person a nasty burn. If the victim has a burn, remove any clothing that comes off easily and rinse the burned area in cool running water until the pain subsides. Give first aid for burns. If the person is in shock, lay him down with the head slightly lower than the trunk of the body. Cover the person with a warm blanket and stay till medical help arrives. Do not touch the victim with your bare hands while the person is still in contact with the source of electricity. Do not touch the skin of someone who is being electrocuted. Do not get within 20 feet of someone who is being electrocuted by high voltage electrical current until the power is turned off. Do not use electric appliances while showering or wet. During the rainy season, stay away from electric poles and snapped wires. Do not do electric work without wearing gloves made of insulated material.
Is snake bites. Snake is a carnivorous reptile that lives around our houses, bushes, and forests. So there are a lot of species of snakes. So some of them are venomous, some of them are non-venomous. So whenever you see a person is bitten by a snake, there are a few things you can do to help him. So what are those? You should rescue him from the snake. So move with him from the snake. Don't try to kill the snake. Move and leave the place. After that, try to remember the color and shape of the snake, because there are a lot of species of snake. So if you remember the color and shape of the snake, it will help to identify the venom and identify the antivenom of the snake. So it will be very easy to give the treatment to the patient. That's why you have to remember the color, shapes, so that you can identify which snake has bitten the patient. After that, call the emergency service for help as soon as possible. So in the meantime, they will take some time to reach the spot. In the meantime, you have to arrange some first aid for the patient. So what are those? Let's see. As long as the emergency service or the ambulance service does not reach you, you have to try to keep that person calm and quiet and normal, because it's going to keep his heartbeat normal. Otherwise, if his heartbeat gets higher, the blood flow is going to be high. So there is a high chance of the spread of the venom throughout the body. So you have to keep that person relaxed. So you have to lay down the person with the beaten body part below the level of heart. It will help him to relax. So if there is any tight item like a ring, watch, or any tight cloth around the wound, try to remove it. Otherwise it is going to increase the inflammation of that wounded place. So after that, there are few things we should not do with a person who is bitten by a snake. Those are, so what we should not do with a person who is bitten by a snake. First thing is, do not try to suck the venom out, because very insignificant amount of venom will be sucked out, and moreover that person can be in danger. His life will be in danger. And do not cut the skin around the wound. This is not going to help. Moreover, it will enhance the infection. And do not apply any kind of ice to the spot. It is not going to help. Fourth thing is, don't move the person unless it is in immediate danger, because it is going to increase the pain of that person, and also it can enhance the heart rate, and this is not going to be helpful. Fifth thing is, don't try to catch the snake. This is going to be the wastage of time. Last but not the least, never go to the snake charmer for the treatment. This is going to be the complete wastage of time, and every second is important for the patient's life. So what you can do until the emergency service reaches, you have to give him the first aid, and whenever the emergency service reaches, you have to take the patient to a best possible hospital and give him the treatment to save his life. So there is a small video on snake bite, the first aid we can give to a snake bitten person, and it is going to help you to better understand. Let's see the video.
This is Mr. John. He likes to go for an evening walk in the park. One evening he was walking in the park, and suddenly he was bit by something. He screamed and looked around, and he realized it was a snake. He shouted for help. It is a good idea to notice the color, body scales, head, or any special characteristics of the snake, because it will help the doctor to identify the venom. If you missed it, it is okay. Do not waste your time looking for the snake or trying to kill it. The most important thing is the victim should remain calm, relaxed, and fearless. Otherwise, it will increase the blood flow and the heart rate, resulting in the rapid spread of venom. Do you know only 20% of the snakes are venomous, and there are 50% chances that venomous snakes will deliver a dry bite. Even if a snake has delivered a venomous bite, by following the correct treatment and measures, you can easily save yourself from any injury. One of John's friends came to help him and called the ambulance. He moved John to a safe place. The affected part of the victim should be kept immobile as much as possible while moving the victim, and it should be kept below the level of the victim's heart. The helper makes the victim sit on the floor with the affected legs stretched. Remove any tight-fitting clothes, any rings, wristwatch, etc. from the affected body part or on the wound itself. Otherwise, it might cause swelling. It is important not to cut the wound, as it will increase the chances of infection. Do not suck the venom, because it will only remove a negligible amount of venom and might also poison the helper. Do not eat or drink anything, particularly caffeine or alcohol, as it increases the heart rate and blood flow. Arrange a long bandage or clean cloth. wrap up the wound loose enough to insert a finger and wrap it up till the top. Do not use a tourniquet, as it could potentially restrict the blood flow to the affected area. Do not use ice on the wound because it might increase the damage. Immobilize the body part with a wooden piece or a stick and tie it with a bandage or a cloth before you transfer the victim to the hospital. The doctor can then detect the venom and administer the suitable antivenom to the patient. Presence of mind in immediate treatment can save the life of the patient after a snake bite.
So this is the book activity of page 87 that we are going to complete now. So let's start with the fill in the blanks. First one is dash is anything that happens by chance and causes damage or injury. The answer is accident. Accident is anything that happens by chance and causes damage or injury. Second is snake live not only in the bushes and forests but also around our houses. We can prevent drowning by learning how to swim. Fourth one is an electric shock occurs when a person contacts with the source of dash, electricity. Now let's move on to the tick mark. First one is what is the good way to prevent the fire accident? To prevent from the fire accident, we have to keep ourselves or keep the things away from the fire. So the answer is number D. Number 2 question is what should we do for a burned person? The options are cool the burn with cold running water. Number B, use ice to cool that burn. We know that we cannot use the ice. Number C is apply cream, ointment, lotion or butter. But this is not the first thing. Number D is break blister as soon as possible. We cannot do that to the burn spot. So what is the answer? The answer is what should we do to for a burned person? We will cool the burn with the cold water. So the answer is number A. Third one is what should we do for a person bitten by a snake? Keep the person as still as possible. Or number B, try to suck the venom out. Or number D, try to catch the snake. Or number C, cut the skin around the wound. Which one is the correct answer? The correct answer is number A. Because we have to keep that person still and calm. So that person is relaxed and his heartbeat is relaxed and there is not increase in the blood flow. So this was all for today's class. Homework for today's class is reading practice, page 85, 86, and after that complete the book activity from page 87. Thank you all for paying attention in the class. Hope to see you soon. Goodbye.